Absolutely. Hi, everyone. My name is Reeva. I am from New Jersey. I'm a rising high school senior. So tricky times now with college apps. But yeah, it's amazing to be here. I'll quickly share my screen for the presentation.
Sure.
Is it visible?
It is.
Awesome. Okay. So today I'm going to be talking about using technology for healthcare innovation. I'm sure you guys know we live in the era of computers. This is the digital age, and we've witnessed a surge in the number of technological devices that exist around us. We have around 5 billion mobile phones in our world today. It's just amazing how many different types of devices we use in a household and in our daily lives. And we've also recently witnessed the rise of AI, and this has most definitely had spillover effects in various sectors. Like you can see, AI and technology have revolutionized education. A lot of schools give us MacBooks and computers now. We've also been able to connect with each other on global platforms in a much easier way, like with Zoom and WhatsApp and so many other different platforms available to us. And most importantly, healthcare has really witnessed a transformative effect from this rise of technology and AI. Like recently, AI has shown a lot of potential in the healthcare sector. For example, with AI algorithms, we can much easily use chest x-rays and detect and highlight potential abnormalities. Before, this process used to take like days, but now it can be done in a matter of minutes. For example, in a recent study, like with AI, they could use lung altitudes and find the biomarkers that could lead them to discovering if someone has lung cancer or not. And another thing that AI has helped us do is move a step closer to prescription medicine. Now, with the medical imaging available, we can easily identify these novel biomarkers, and using these biomarkers, we can identify particular treatments and tailor them to an individual's unique genes so that they could get the most out of it. And this has really made it easier because now patients can get the treatment they need, and it can be really catered to them instead of being a therapy that everyone has to go through. And this can be seen in like the number of prescriptions that are put out nowadays. They're more catered and they're more tailored, and this has improved the patient survival rates from a lot of diseases. But with one thing that we all just sometimes don't notice is, yes, technology is great. Healthcare access has improved, but still access is a really big problem. In fact, half the world still lacks access to essential health services. And amidst the rise of these novel advancements, the fact that these life-saving solutions are not available to a lot of people is what really touched me. And that's why I've been working on developing applications that can really help people in these rural areas who don't have this access. So just as a statistic, around 46 million Americans live in rural towns. It's like 15% of our population in America. And that's just one fragment of the world. So in the real world, you can see like a bunch of people, this number tripled and quadrupled, who live in rural areas. And these people actually face a lot of health disparities and challenges. Statistically, they're more susceptible to various health conditions, including heart disease, cancer, respiratory disease, stroke, and many more in comparison to their urban counterparts. And these disparities exist as a result of the gap in healthcare availability. And they're also hindered by factors like geographical distance and limited access to these advanced medical facilities and specialists. So this is a major problem, and everyone deserves that quality healthcare treatment. And that is what I aspire to bring with my applications. So recognizing this urgent need to bridge the gap and improve healthcare accessibility, I'm working on developing two applications. It's MedAid and OptiTech. And these are basically easy to use mobile applications that leverage the power of technology to bring the change. Like I said before, there's 5 billion mobile users worldwide. So what is better than that? Like, using technology, using mobile apps, we can solve problems that exist in the healthcare field and work on these to make sure that everyone gets these apps and escapes from these problems. So I'll talk about MedAid first. MedAid is like a medical companion. It uses remote monitoring as its cornerstone approach to solve the problem of people not receiving medical advice and also the problem of adverse drug reactions. So I'm just going to detail a little about adverse drug reactions, or ADRs, a bit before I move on. So ADRs are actually the 6th leading cause of death worldwide. And the reason these problems occur is because people consume a lot of medications at the same time. So in America today, we have an overflow in the number of medications available over the counter. We're typically consuming prescription medicines and over-the-counter medications simultaneously, but this is actually very dangerous because even though medicines save our lives, sometimes they can adversely react with each other and cause us this major health risk. And because the number of people consuming 5 medications has nearly tripled in the past 20 years, I thought that this is something that's really important. Like even in my household, I've noticed my family members consuming more than 3 medications, and that's actually kind of dangerous. So with MedAid, you can really solve this problem, and it uses machine learning algorithms to solve this problem of ADRs. So let me just quickly walk through a demo. So what MedAid does is it makes the process of actually seeing the medications and putting them in your phone very easy. If you go to typical platforms like drug.com or any other platform database, you have to enter each and every ingredient in your medicine. And that's really tough to do. Like, I don't want to sit around entering each medication ingredient. What we do at MedAid is we make this process super easy. We use OCR technology so that you can use your phone camera, just scan your medication, and using the databases we have connected, we try to locate what this medicine is. For example, this was a Witz peppermint, and it identified it. It also identified what it does and certain symptoms. Now you can do this with every medication you consume and just add it to the scanner. And based on the medications you upload, it calculates the probability of an ADR occurring. If there is any danger, it connects you with aid and connects you with specialists in the distant urban areas near you so that you can really get that consultation you need and escape from an adverse drug reaction. And you can also use MedAid for just any medical consultation. For example, if you want to consult a nutritionologist about something, that's what we try to do at MedAid. We make that process super easy and we allow you to get that advice in a very efficient way so that you can get that consultation and also escape from any potential disease. And the thing with MedAid is it can really save a lot of lives because, as I said before, ADRs are such a common occurrence and they can happen to anyone who consumes multiple medications. So like, because this is such a common problem and medications are so important to us, this is something we should be aware about and also keep in mind. And the other thing I've been working on is OptiDetect. So recently I discovered that uveal melanoma is a very common eye melanoma that exists. And I really love coding and technology, so I started working on something that could use just common devices we have and also try to detect like eye melanoma if possible. So recently I've been working on this prototype that you can use your phone camera with like an enhanced scanner that's like a physical device, and you can hold it close to your eye so that it can scan, and then using those images, we can use machine learning and databases available on the web and published by the CDC and really scan if there is any occurrence of like a melanoma tumor or something so that you can really connect to aid. Because a common problem with melanoma is the early detection. So a lot of people don't go to specialists and a lot of people think that it isn't that big of a problem until really big symptoms occur. But because you can't wait too long for that symptom to occur, it's important that you really take it at its roots. So by making this scanning phase easier, we can really prevent the number of people that have to go through those other stages. And if it's available to you on your phone through the use of like a small device and your mobile app, I think a lot of people will really resort to doing that. And just overall, the main problem in healthcare is that accessibility doesn't exist. 80% of health problems can be better managed and even prevented if there was early detection. So considering this, with the power of technology and with the power of the handheld devices we have with us today, we can truly revolutionize healthcare and bring these disease rates down. So technology really has this transformative ability. It can bridge the gaps in accessibility and revolutionize not just patient care, but also the operations for, medical professionals and basically everything. So with MedAid and OptiTech, I really aspire to contribute to this positive change and make these healthcare solutions available to everyone and work towards that more healthier and equitable future, because every individual, every community should get this aid. So I just wanted to thank Gift at this second for giving me this opportunity to present about these two solutions and the problem of accessibility as well as technology and healthcare innovation. I think these are things that really need to have light shown upon, and this is a great platform for doing that.
Well, thank you. My first question is, where does a high school student learn this? What on earth are they teaching you? I mean, are you learning this in high school, or are you taking other classes, or are you doing research on your own? How do you come across this information to build something like this?
So I really liked coding, and I was a really big researcher. So when I was just researching and coming along, I was like, what are the most common diseases? And I came across ADRs and melanoma. And I was like, okay, there has to be something about this. And then also just going to the hospital every time is like a tedious process. And the hospital from my house is like 40 minutes away. So I thought that was a problem. And that was a commute that I didn't want to do. And I noticed that a lot of people out there must be facing the same problem. So with coding, I thought that I could develop something, and then I just researched, and that was my path that I paved along and worked on this.
Yeah, I mean, if we can take some of these things that are detectable through technology out of the hands, at least the first out of that visit of a specialist or a doctor right away, it leaves their time open for other things that can't be detected through a device. I'm glad we have a little bit of time for questions, because I'm jumping in here, Amy. I have a few, and I'm sure Amy has some too. So what are your concerns about privacy issues using an app? Is it any more likely to be privacy issues with an app than with MyChart that everyone uses right now?
I think the privacy concern is kind of minimal with an app, because the data is always encrypted. And also when you do upload your records, it's like a jumble. So you don't input your name and everything. You could just input the record. You could put scans of your medications. So you're not technically releasing any personal and private information in that sense. And whatever you're giving to us is always stored in a very secure manner. So we do value privacy and security, and the encryption allows your data to be safe at all points in time.
Okay. And is MedAid, and is it OptiScan or OptiCon?
OptiDetect.
I'm sorry?
OptiDetect.
OptiDetect. I had it wrong both ways. Are those working prototypes right now? I mean, are you using those? Can they be used, or they're still in development?
So for MedAid, I've been working on the algorithm for around a year. I'm working on finalizing it. And if I do want to publish this, this is definitely something that requires HIPAA approval and a bunch of other approvals, because it deals with health. I do look to publish it in the near future on the App Store and everything, but right now I'm just working on developing it and making sure its accuracy is as good as it can be. And then for OptiDetect, I have a small physical prototype, but I'm still working on that so that it can be improved.
And then my last question for you is, you said we a lot. Who's the we? Who are you working on this with?
So I do have, so the seed actually came from a group of friends, and we're working on this together. And I also have a bunch of healthcare professionals I consult, because in my family, we have no one from the healthcare field. So I do have to get a lot of help from outside and really cold email, take that little initiative and that jump of faith and contact these professionals, work on like seeing if any features can be improved, getting their advice on what the app is like and what it can be, because these people deal with these issues on a regular basis. They know what's going on, they know what the main problem is, the crux of it, and the insights I can get from them and the advice I can get from them on my features really helps me improve them. And I just go about that way. And also with research, I feel like getting advice from professional researchers in drug discovery has really helped me, because they point me to the right resources and areas I can look, and then I can really improve based on those.
Okay, I'm gonna let Amy ask some questions now, because I took too many, and I know that Arturo has questions too
Right,
from YouTube.
Yeah, let's do the YouTube one first. He says, great work. There's a growing concern that technology and AI will replace human jobs. What's your point of view in medicine? What will be the implications of AI use?
I think in medicine, AI can really be helpful because it can perform some surgeries and like scannings for us. But at any point in time, you always need human supervision, because this is such a intricate task, especially with surgeries, that not everything can be handled by AI. There are so many things that could occur and different things that you need to consider, especially with a person's behavior. Like if a person starts behaving in another way during a surgery, that needs a human. So although some surgeries can be performed, AI can help us in medical imaging and collecting that data and finding those cross points. It really can't take over in the medicine field. There always has to be some sort of human interaction involved.
Thank you. Has this project that you've got involved in with all the research and the help and working with your friends, has it influenced what direction you want to go? You talked about college applications, and like, has it influenced your future direction and what you're thinking about?
Yeah, absolutely. I think academia and research is something I really got interested into by working on these two projects. And then I also really fell in love with coding because I could create something that's so cool. And I personally found that really interesting. So I was like, I need to work on honing these skills. And that's what I want to go into the future, probably something with technology and public health policy so that I can make these a reality.
When I listened to your presentation, I was like, Julie, first of all, like, you're so young, like to have all this knowledge and be doing this and be so innovative. It's amazing. I applaud you for that. But when I also listen to your ideas, it's like, it's such a big problem. And it seems like it's such a great solution. It's hard to believe that it hasn't been already done or thought of, because it's needed and it is a big problem. And it seems like, as Julie said too, going to see a specialist, if you go to call, like even people that have access to healthcare, it can take months to get in to be even seen about something. And it may be something super serious, or it may be something that's not. And as Julie said, like if you could have that almost predetermination, whether through your app, whether it would be something that, needs to be looked at right away, the melanoma early detection, or maybe it's something that isn't important at that time and somebody else could be in to see that spot, because there doesn't seem to be enough time in the healthcare profession's day to be seeing everybody. So I think you need to work quickly, because I think you have some great ideas.
Thank you. And I absolutely agree with that. I think that's what we try to solve, because I have seen that this is a really big gap and people who need aid don't get it. And that's why 80% of the problems reach a stage that they shouldn't have reached. And it becomes much more critical, and that's when you get the aid. But if you could get it earlier, the problem would have not happened in the first place, especially with ADRs, because so many people consume medications. This is something that is so needed at this moment. And over-the-counter medications are always increasing. Supplements are something that almost everyone is prescribed nowadays. So if there is an app like that that can sense these potentials and tell you to go get that help before you reach those symptoms, that is something that could really be life-changing.
we only have about 30 more seconds, and in that time, I wanted to give you the opportunity to share, if you haven't asked, people are watching this now or watching it later over video, if there's anything that you want from them. You're looking for people to help with the project, or you're looking for funding for the project, if you're just not looking for anything right now, but it's your opportunity for an ask. And I also want you to think about coming back in a future gift and update us on how it's going.
I definitely come back. I think the only thing I want to say to people is to really be aware about the solutions they can bring. These are problems around us. The seeds are around us, and all it requires is that initiative, like that. You have everything at your fingertips with the internet. Technology is so powerful. You can really bring the change if you want to. So just find problems near you and think of solutions and make them a reality, because any seed can turn into an idea, and that idea can turn into a startup, and you have the power to make a difference from wherever you are. The world is connected with the internet, so we should use it, and we should solve the life's problems, because we are humans. This is our planet, this is our safety, and these problems are things that everyone combats. So you can really make a difference in someone's life by just one solution and one idea.
Wonderful. Thank you so much. What a great presentation, and I'm so glad that we ended up connecting, and we won't drop this connection from here. Let's keep in touch, and the next gift is October 14th, 15th. And so sign up early so you can get the time that you want. And now that you know the process, you can sign up every time.
Absolutely.
Thank you, Reeva. Thanks a lot.